for the pulmonary rehab, and they're going to tell us about the service.
Brilliant. Thank you. Thank you all for, first of all, having us here. So my name is Divya Narasimhan, and I'm one of the physiotherapists working on a NCL-wide project around health inequality in pulmonary rehab. And I've got my colleague Jane. Jane, do you want to quickly?
Yeah, just to say I'm Jane, working alongside Divya, and again a physiotherapist. And can I also introduce you to Neil, Neil Connell, who has kindly joined us and will talk to everyone during the presentation. And Neil, you're a patient from Camden. Oh,
you're on mute. You're on mute, Neil.
Yeah, I've took part in the pulmonary rehab. I've done it remotely and in person. So
brilliant.
Yeah.
Okay, thank you.
So I'm going to share the slides and then we will get going. The first thing I wanted to do is actually a Slido. So if you all could take out your phones or use another browser if you have, and log on to Slido, or I will also give you, can you all see that on your screen?
Yeah.
So if people could take their phone out or use another browser with slido.com, or you can use the QR code. Once you go into Slido, it will ask you for a number. If you could put that number in for me. And you should also see this question. This is just a icebreaker to see if you all can see it. And you can start answering. Neil, you don't have to do this.
Yeah.
Okay.
Thank
you. Well, if you want to, for fun of it, you can as well. So looks like you all know how to use Slido. So we'll go on to the next question here. So which NCL borough do you mainly work for? Brilliant, thank you. Do you offer pulmonary rehabilitation to potential COPD patients? It's like every time I meet the patients, when I remember, or never? So this is anonymous. We won't know who answered what, so be truthful. Brilliant, thank you. Next one is rate your current understanding about pulmonary rehabilitation. Brilliant. The polls are still open, so the first 4 questions, so you can answer if you need to as well. You can go back and answer. But thank you all for taking part in it. It's really helpful. So I'm going to share our slides now. Right. So what is the purpose of this meeting is 2 things we wanted to achieve. One is to improve the number of referrals we receive through to our pulmonary rehab service is one, and also to reduce the number of inappropriate referrals the teams receive as well. And you all being in that position of referring patients is really important for you all to understand, have some basic knowledge around pulmonary rehab, so you are able to explain to the patients and address their concern at the point of referring. Now, the next is a bit of a data. I won't bore you too much with data, but the national target for pulmonary rehabilitation referral is around 60%. And here at NCL, currently, we are around 44%, the last financial year. Sorry?
The slides aren't moving on.
Ooh,
Or my slide isn't moving on. I'm
Right.
still on the first page. That's it. Thank you.
Let me reshare. Okay, sorry. Yeah, is it on the data now?
Yeah.
Yes, yes.
Brilliant, thank you. So sorry about that. So yeah, like I said before, the national target for pulmonary rehabilitation referral is 60%. That is what we want to hit. And currently in NCL, that is where we are, around 44%. I have done it individually, individual PCN and borough-wise, for you all to see where you are, where your PCN is currently. It will be great if we could all improve our referral rate, but at the same time, being mindful that we don't want to refer inappropriate patients into this service as well. Right, so I'm going to hand it over to Jane, who's going to talk about pulmonary rehabilitation in detail, and then I'll come back again. Oh, my slides are not moving. I don't know why. I'm so sorry. Technical issues.
Technical.
Let's see.
Okay.
Sorry about this.
That's all right.
Okay.
Okay. So what is pulmonary rehab? Pulmonary rehab is a combination of exercise and education, which is offered in an integrated way. It's designed for people with chronic long-term lung disease. Most of the research has been done in COPD patients. It's extremely well evidenced in that cohort, but there is more and more research now being done in bronchiectasis, fibrosis, chronic asthma, different lung diseases. But it is that combination of education and exercise. The education is very much geared towards helping patients actually understand what's happening to them, why they've got the symptoms that they have, and also giving them a toolbox to manage those symptoms. And at the end of it, hopefully feel more confident. There's quite a large social element to it, so that you're with other people who experience CT. So the next slide. So why pulmonary rehab? I think we're hardwired to think that if we feel breathless, there's potentially something wrong with us. So as children, if you get really breathless, you stop and you rest. And what happens with our patient cohort is that you can get into what's called a vicious cycle of inactivity. So initially, you experience breathlessness more easily when you're exercising, but then as disease progresses, that breathlessness is there constantly. But what happens is, because you feel breathless, you become fearful that that activity will make you more breathless, so you avoid that activity. By doing less activity, what happens is that your muscles become weaker. And COPD is not just a disease of the airways in your lungs. It's also a disease that affects different systems within your body, one of which is your skeletal muscle. So we know that your skeletal muscle fibers change and you lose strength and endurance within your skeletal muscle. But then if you do less activity, that also makes that worse as well. As your muscles change, you become less efficient in the way that you're using oxygen. That in turn will make you more breathless. So where pulmonary rehab works is that it breaks that cycle. You will be exercised to a level that will make you more breathless, which feels very alien to someone who is it's an uncomfortable sensation, but knowing that you're going to do that in a supervised capacity, and you will also be working on your strengthening your muscles as well and making them more efficient. Next slide.
Sorry, Jane, it's not moving again for some
Don't
reason.
worry, I'll talk anyway. So pulmonary rehab is usually offered on as a 6-week course, 6 to 8 week course, attending twice a week. Each session lasts about 2 hours because you will do an hour of exercise. That will involve a warm-up, 30 minutes of aerobic work, some strengthening work, and then stretches at the end. And then there'll be a short break, and then there's the education component. And classically, it as I say, it lasts for 6 to 8 weeks. So that's quite a commitment that is needed in order to be involved in that. And we're looking more flexibly, I think, at using some virtual rehab in some instances, and also just trying to meet the needs of patients generally. But that's what the research shows is the effective combination, 6 weeks. Any patient would need to undergo an initial assessment. The assessment would be done by a physiotherapist, and as physiotherapists, we're used to looking at people who have movement disorders, who have multiple comorbidities. So I think if patients are saying, "Oh, I've got arthritis in my knee, I'm not sure I can do it," then we will adapt the exercises, and the exercise is tailored to the individual. So you would do that, we'd do a walk test with you or some sort of exercise test and some questionnaires. And at the end of your course of treatment, we would reassess you, and that information will be fed back to whoever referred the patient in the first place, so that there is feedback as to there's feedback as to how the patient's done. I'm sorry, I've just got something strange come up on my screen here.
Can you not see the inclusion exclusion now?
Yeah, I can see that.
Brilliant.
Sorry, I got something else came up.
Okay.
So inclusion and exclusion criteria, really important to bear these in mind when you're referring patients, to make sure that you're not spending time referring someone who wouldn't meet the criteria. So inclusion criteria, we need the patients to be motivated, and I think an honest conversation with the patient. If they're in doubt, they can be referred in and we can have that discussion, or the team that they're referred into can have that discussion with them. But if someone is very clear that at the moment I've got X, Y, and Z going on in my life, now isn't the right time, that's fine. It's not a now or never. The option to refer in will always be there. Patients should have an MRC of 3 and above, so that they are functionally impacted upon by their breathlessness. and they should have a confirmed diagnosis of a long-term respiratory condition. In Camden, it's only COPD. In the other boroughs, it can be other conditions. Appreciate that with COVID and many other things, there are some patients out there who clinically have COPD, but maybe haven't done gold standard spirometry test. But if there's evidence on any radiology that they've got COPD, then that would suffice. And again, the patient should consent. And that sounds straightforward enough, but I know where I used to work previously, we did get referrals through for patients, and when you contacted them, they didn't know that they'd been referred. So please do just make sure of that. Exclusion criteria, often some of these aren't absolute, but we would ask that the any other comorbidities that the patient has are being optimally managed. And once that's all stable, then they can be referred in. Patients with severe heart failure or unstable angina wouldn't be appropriate. If someone's suffered an MI or stroke in the previous 6 weeks, again, that's not the time to refer them in. Aortic stenosis, abdominal aortic aneurysm. If they've an active infection risk, then again, don't refer them in. This is quite a vulnerable group. Severe musculoskeletal problems. So if someone genuinely can't get up out of a chair, then, or is housebound, then that wouldn't be appropriate. And dementia, I mean, there's a whole continuum, isn't there? So if someone has mild dementia, can engage, can maybe bring a carer with them so that there's some overlap of information, then that's fine. But if someone genuinely is at the more severe end of the spectrum, it might not be the right treatment for them. So those are the inclusion and exclusion criteria, which all of the services will. These are nationally recognised criteria. So can't hear you, Divya. Any questions from that? I haven't checked the chat.
Sorry, I was just saying, for some reason, the slides are not moving when I share them.
Okay.
There's just whether we can have the presentation. I wonder if we can just thanks Divya. Yeah.
Yes.
Maybe it might be a good idea to share them with Barbara, and then we can figure out a way for everyone to have access to them. I just had a question. If anyone else has any questions, please do post them in the chat. Oh, Catherine's put one up. Is there a patient leaflet to show the patients what's involved?
Yes, we will talk about it in further down. But yeah, I will answer that. There is a leaflet in Whittington. There is leaflets for NCL. The presentation, actually, at the end of the slide, I have included the leaflets as well, so you all will have access to it. Right. The next, we are going to hand it over to Neil, if you're ready, Neil, to chat about his experience.
Yeah. Okay. Hi all. Yeah. Just listening to Jane there just brought back quite a lot of memories and experiences that I went through, because I think the first time I went through it, I was just referred by a doctor, and I had my OBS done, and I was sent for a checkup because my pulse, I'd done the exercises and my pulse was low or something, so I had to go for an ECG and stuff like that. So and really, like, I didn't know anything about COPD, and I'd got to the stage where I was like of really badly, just I'd been in hospital with pneumonia, sepsis. I was really finding it hard to do things, and I become really isolated and just was labelled by this, by just being ill, really. And so luckily this doctor referred me, and then I began to engage with it, and it is frightening being breathless. Like, I remember, walking upstairs to where I live and getting out of breath, and I'd have panic attacks and stuff. But from the pulmonary rehab, I've learned that it's okay to be breathless. like when I was younger, I did sport. It's all right to be breathless, but when you got COPD and it's breathless, it creates a lot of fear. It does for me. But so it's, you know, as was said by Jane, you get the education after you do the exercises, and it's catered for the individual. I mean, I was thinking I was really inactive and I couldn't do much, and within like 2-3 weeks I was doing star jumps, just, you know, lifting kettlebells that I'd bought before COVID that I hadn't used. And one of the, because I was doing it remotely, they said, have you got anything you can lift, like a bottle of water or something? I was like, well, I got a kettlebell that I had 2 years ago. She was like, we'll get that. So, and they've, you know, and it's very much catered for the individual, because like I started off pretty slow, but then I picked up and I felt like I could exercise, and as I got less scared to be breathless, I knew it was all right. And it was a safe place as well. So so yeah, it just kind of opened my world up a lot from that, being that insular. And even when I've been to GPs, asked them about COPD, not many of them could really give me a definitive answer. It's so yeah, so, you know, it was eye-opening as well to find out. I always used to watch films, and when I see the oxygen tubes up someone's nose in a film, I'd cringe, I'd be scared, I'd think that's where I was headed. And then I actually asked on the questions afterwards, and they said, no, that's got nothing to do with COPD. So, you know, I've all this stuff in my head, but, you know, about like misinformation about COPD. So it was, because I didn't know it's about getting oxygen out of your lungs. That's why it's important to do exercise, to, you know, to get the oxygen out of your lungs. But I was just lucky that I did get referred, because that's the only one time that someone mentioned like about what any treatment for COPD. I'd never been advised by any other doctors or anything like that. It was just this one doctor that referred me. And yeah, and it's just when I did it in person, it was twice a week for 6 weeks, and you get, you know, some days you might have something else happening, or you don't feel quite up to it, so they give you some, you know, they give you leeway. And I must admit, the team are amazing that deliver it. It's I did it 3 or 4 years ago, and I just finished it recently. And there's been, I wouldn't say improvements, because it's always been really good, but there's just a lot more information out there. And as it's gone, it's improved even more, because I suppose, yeah, more knowledge about COPD. And it's quite hard to live with a condition that you don't really know anything about it, and doctors, as I say, don't really know a great deal. They just, as I say, refer. But yeah, it would just be remotely. Sometimes it would just be one of the team and myself, and so, you know, it just really is catered to the individual. And I feel like they're very personable. It's very relaxed. You know, quite, you know, it does more than just treat the COPD. I think it's a very mental, physical illness as well. It definitely helped with the mental side of it and the motivation, because when Jane was saying something, it reminded me I'd missed a few classes, and I had things going on in my life, and I was lacking a bit of motivation, depression. And I spoke to one of the team, put it off. And at first I was a bit like offended to it, but actually she was absolutely amazing, because that's from that day on I really committed to it, and I did it, and the rewards are just unbelievable, really. You know, I was like having trouble doing the basic stuff, and now, like, you know, I like when I did the walk, when you start, they give you a walk test. There's 2 cones, and you walk, and they measure like your distance with getting breathless. And when I went back, I'd improved that much that like they just said, like, we just stop it there because we'd be here all night. So that just shows you that improvement in 6 weeks. It was just, but it's just a lot I can say about it. I'm trying to find the words, but it's just they are just really like sensitive, like very much deliver it with a hell of a lot of care, very like catered, like person centered to the individual, and yeah, you just supported the whole way. And you know, and I mean, everybody I know that's done it and I've spoke to have all really enjoyed it from the social side, you know, and also just the team, you know, everyone, you know, people, I couldn't speak highly enough of the team that deliver it, but I don't think there is enough information out there with doctors and GP practices. I don't see it up a lot on, you know, and I don't think people, you know, I've asked doctors ask me about COPD, so so really I don't want to I can't really think of much else to say, but it's just, yeah, it really is a life changer. It's one of those that's like from sitting on a sofa doing nothing, literally, you know, like losing muscle wastage. I was quite sporty when I was younger, but literally going to sitting on a sofa, having no quality of life, doing that gave me my life back, really. It gave me that zest. And also that it's okay to be breathless, because, you know, I haven't had a panic attack since. So, you know, really, that's all I can really say, really. But yeah, it's, I mean, I've been phoning them for the last year going, when am I next up? When is my turn? When am I? So, you know, that's how great it is, because literally they'll be like, okay, don't worry, we'll phone you when it's your time. So, yeah, they're an amazing team, and anyone who gets referred there is really lucky. So I'll leave it with that. Thank you.
Thank you, Neil. That's really really helpful. And one other thing I just wanted to add is one of the beauties of pulmonary rehab is if someone completes, we get to spend 24 hours in the company of that patient by the time they've attended for 6 weeks, 2 hours twice a week. And one of the beauties of it is we can go through inhaler technique in a teaching session at the beginning. And then there's the opportunity to go back and repeat it and make sure that that learning is as ingrained as it can be. And also patients can come back and say, I really didn't understand what you said. Do you mind going through that again? Which just doesn't happen in a busy GP 20-minute appointment slot. You just can't do that. So that's really just to reinforce as well. I think one of the real benefits of it is it's that continued contact, and patients feel able to, they know you, they feel able to ask questions. So
yeah, can I just say one last thing on that, Jane? Because that when I finished, it was like, if you're not finished, if you ever need to speak to us, we're here 24, you know, like we're here the whole time. So it's really feel, because, you know, it's just, yeah, of that element of safety, and you can just I've picked up the phone, got advice loads of times. So
that's brilliant. Thank you, Neil.
Thank you, Neil.
You're welcome.
Just wondered if anyone has got any questions to ask Neil. Neil, there is a lot of thank yous in the chat box for you.
Okay.
Yeah, and a lot of well done's for you as well. But if anyone has any questions to ask Neil. What is the time between people do rehab in the chat box? It is usually a year time from when they complete and the next time they come in.
Yeah.
And
yearly,
just to clarify, the next time they come in, you contact the individuals directly. There's no need for like a re-referral.
Yeah, they contact. Yeah,
you contact them. Great.
They contact me.
That's Camden.
That's Camden.
I don't think that's across the board.
Individuals. Yeah, we'll talk about
Right.
individual services.
Fine,
yeah,
fine.
Because every
Lovely.
service works differently across.
Works differently. Okay.
Not Central London.
Okay.
Lovely. Thank you.
Okay. Thank you, Neil, for that. I'm hoping the presentation will share well this time at least. You know what? I'm not going to go to the slideshow side. I think that's where it gets stuck. So I'm going to leave it like this. Hope people can see it. Yeah.
Yes,
Okay.
yes, yeah.
So I'm just going to quickly go through individual services. I'm not going to go in great detail, just a hint of it. So Jane did speak to you all about the general structure of pulmonary rehab, the 6 weeks, twice a week, the exercise and educational component, the initial assessment and final assessment, which is all the same for all services across North Central London. So the differences will be, so in Barnet, they provide a remote service, which is on Zoom. And they also do a face-to-face sessions, and they also do a blended session. So what they mean by blended session here is the patient can do one session once a week face-to-face, once a week remote. So they can have a choice. Okay, so that's the other type they provide at Barnet. They're provided in 3 different venues, and the days are all listed here. Transport option is available for patients who need, except for those who live at East Barnet. We're trying to sort it out, but currently, patients who live in East Barnet, there is no transport. For the rest of the Barnet, there is transport facility organized. Referrals are accepted from all physicians, they've said. So you should all have, the Barnet people, you should all have access to the referral form through your email system. And all you have to do is email it to this address or the address on the referral form. And patients can be referred back in a year time here. Okay. The next is Camden. So Camden do remote via Zoom and also face-to-face. They currently have a session going on at St. Pancras. They were supposed to open one in Peckwaters this month, but has to be stopped because of few issues around, but they will be there very soon. They're also looking for a venue in the west of the borough. So that should be up and running sometime this year. It should come up as well. Now they can arrange hospital transport for patients who are struggling to get to the venues. Okay. Now they also accept referral from everyone, all practitioners, and they also accept self-referrals. And when I spoke to the team, the self-referrals are usually for people like Neil who already know what the service is about. They already have got the contact number. They can pick the phone up and they can say, look, I finished last year, blah, blah, blah. Can I come back again? And this team will be able to take them in. But if the patient doesn't want to ring and if they want a referral to be put in, please do put in a referral as well. Again, they will take them after a year. And Camden is the only service within North Central London who accept patients only with COPD. They don't accept other respiratory conditions like fibrosis and so on. They don't take them in. They're only commissioned for COPD. Things might change soon, but for now, this is how it is. Going on to Enfield. They again do face-to-face and virtual. They are currently in 2 venues. They also have a virtual rehab there. The days and the timing are all listed. Again, they can provide taxi for those who need it, but it's again the clinical decision, the clinician's decision. It's not like for everyone they're dishing it out. Referrals are again accepted to primary care, secondary care, and self-referral. Again, it's their email. You can email it to them. Patients can email or ring them and say, I'm interested. Yes, they will take them in as well. Again, ideally in a year, patients can come. And every service says in a year, but if you feel that a patient is admitted in hospital, he had a bad turn and he needs before that 1 year, come back to us before that 1 year, yes, we will accept them. We will not say no, if there is a valid reason for that. Okay, that's what every service would do. Now, someone in the chat asked about language. So Enfield, they are currently piloting a Turkish. They did run a Turkish only group, but it didn't work out very well. So currently what they're doing is they have an interpreter within the mainstream pulmonary rehab group to sit with the Turkish patients who is able to translate it to the patients. And that way they are getting things moving there. And this can be done in all boroughs as well. So Enfield do offer for housebound patients as well. So that's one thing. Coming to Islington Haringey, so for both of them, it's provided by the Whittington Health team. They only do face-to-face. They don't have any virtual rehab. They do it at Whittington, and they are to start very soon this month. They will be starting in Upper Street as well. And they have 1 venue in Hornsey Central, We do know that we need a venue in Tottenham end of Haringey. We are desperately looking for a venue that way. So soon, watch the space, there will be one there. Transport is organized on request. If the patient requests and if it's needed, yes, it can be organized. Again, referrals are accepted from GP surgery, secondary care, and community teams. Again, refer it back in a year time. Any questions at all with this before we go on to the more Slido? Have I answered
Sorry.
all the questions that came in the chat box as well?
I think so. There's just one. Which form can be used for referral and Barnet?
Which form? Yeah.
Mm-hmm.
Do you not have a referral form in your EMIS system, GP system? You should.
I can't. I can't answer
If
for Barnet.
Not, form which I could send it in, but I are all.
She has one. Eleanor, I think there is one. Yes.
Oh, okay. Okay. Brilliant. Okay, that's brilliant. Yeah. Is that any more questions on that at all, or I can go on to the next part?
Yeah, carry on, Divya. I'll keep an eye on the chat.
Brilliant. Okay, so the next part we are going to go back to Slido. So your phone's out again. This time we want you to think about the barriers. As a referring staff, what barriers do you face in referring patients to pulmonary rehab? Brilliant. Thank you all for taking part. There's another question here. So you all said about the barriers. Now you tell us, what do we have to do to make it easy for you to refer patients? What is that we need to be thinking about? What should we do? Brilliant, thank you. So videos, there will be one coming soon from the national side of it, which we will be able to circulate it out to everyone. There should be some short videos, but at the end of the presentation, there is also a slide which has got access to videos that are already present, which you could use for your patients, but there will be some out to be done recently and will be shared across as well. Jane, is there anything for you to?
No, I don't think so.
Okay, someone is typing. I'll let that one person finish typing, get their response in as well.
The language that we've considered across NCL, so the language barriers, obviously there's there's probably loads out there, but the ones that we've highlighted in terms of translation are Turkish and Bengali. I know another group that we spoke to last week talked about Somali. Are there any other, if you could put it in the chat, if you feel that there's a significant cohort of patients that we need to think about in terms of meeting their needs?
You can put that as in the next answer to the next question as well.
Oh, is it? Sorry.
So, yeah, the next question is, using your general knowledge, who are these hard to reach population? If you could just put your area, your borough name, Camden or Barnet or whatever, followed by what is this, who are these hard to reach people, will be as helpful.
There's a question about why other MRC levels can't attend. I think that is based largely upon where the research sits, and where has PR been shown to be really very effective. I agree that I know where I used to work, we used to accept MRCs of 2 and above. I'm sure that will come at some point, but I think the needs of those patients who experience less breathlessness, maybe there's another solution to how you can support those patients. But that's why it is, because with limited resources, those are the ones where it's been shown to be most effective. That's that.
Camden Bengali population, thank you. That is something we are working with. If anyone knows how to approach a focus group for the Bengali population, if your surgery has got a good number of Bengali population, please do let us know. We are keen to do a focus group, but having difficulty. I saw Islington drug users. We are nearly completing. Next week, we'll complete our first pilot for Islington Drug and Alcohol Service. So we ran a session in Better Lives. From the end of January, we will be moving that session to Arsenal Hub. So we are started accepting referrals from Better Lives, who are the drug and alcohol service. We're also having talks with the Camden, that is the CGL, who are the drug and alcohol service in Camden, and see if we could bring Camden Drug and Alcohol and Islington Drug and Alcohol as one PR provided at Arsenal Hub. Once we establish that, we will go to other places, Haringey, Enfield, and Barnet as well around it. Haringey, what's come up in Haringey? Sorry, I've got something. Reduced mobility. Okay. Camden working cohort. So obviously they have got the virtual, but yeah, that's a good point. Where we used to have something called as My COPD, which is like an app, which did not work very well during COVID time. That is something we all tested. So it's an app which you could use any time of the day in your own time, but we found that not many people actually used it well, patient group. But there is out there, it is out there, and we'll have to see what is the best method to get them in. But thanks for that.
We also ran weekend rehab where I came from, and for specifically for people who worked, and uptake wasn't amazing, I think, because weekends were precious. But I think that is something maybe that Divya and I could have a look at.
Definitely. Brilliant, thank you. One last question before I bore you to death with Slido. So having heard Jane speak and Neil talk about pulmonary rehab and its benefits, do you feel now that you're more likely to refer patients to pulmonary rehab? Just one last question. And be honest to us yourself, and so we'll know where to improve, what to do during our presentation. And if you have ways that you think we could have done this presentation better, please do put it on chat. We are happy to take feedback and improve. Brilliant. Thank you. The polls are all open. You could answer the question if you want in your time as well. Brilliant. The last slide I have put in is basically all the information page for each borough, and also access to the patient leaflet. Some useful videos and resources are all there at the end of the presentation slide, which I will forward it to Barbara. So any questions or anything for me and Jane?
I think you've managed to answer everything in chat. If there's anything I've missed, please do raise your hands or add it on chat. But I've personally found your presentation very, very helpful, listening to Neil. And I think working as a practice nurse, one of the things I find very difficult is how do we motivate the patients to join or to consent for the referral. And I think for me, listening to Neil gave me a lot of ideas about what to say on the benefits. So thank you so much. You've got lots of thanks in the chat. So thank you. It's been really, really helpful. Thanks for coming today.
You're welcome.
And any other questions, anybody, before we come to a close? I will be seeing all of you in April, and obviously, thank you everyone. Thanks for all your comments. So yes, Barbara will share the link for the next forum or ask you to register for the next forum. And if there's anything else, I will put my email in the chat box as well, so you've got that if you have any other questions. But thank you all for coming today. Thank you.
Thank you
Thank
all
you.
for
Lovely.
listening.
Bye.
Bye.
Thank you. Bye.
Bye bye.